What if one simple food sitting in your kitchen could help support healthier blood pressure, starting as early as tonight? You've probably seen headlines claiming that one magical food can drop blood pressure overnight. It sounds almost too good to be true. But what if there was actually one food backed by science that could help your blood vessels relax naturally? Before you rush to your refrigerator, there's something you need to know. The biggest mistake people make isn't choosing the wrong food, it's expecting instant miracles. Blood pressure usually doesn't fall dramatically overnight from a single meal. However, some foods can begin supporting healthier blood vessel function within hours, especially when they're part of an overall healthy lifestyle. So which food stands out above the rest? The answer may surprise you. Beets. Yes, the humble beetroot has become one of the most researched foods for supporting healthy blood pressure. Here's why. Beets are naturally rich in dietary nitrates. After you eat them, your body converts these nitrates into nitric oxide, a molecule that helps your blood vessels relax and widen. When blood vessels become more relaxed, blood can flow more easily, reducing the workload on your heart. Several clinical studies have shown that beetroot juice or whole beets can produce modest reductions in blood pressure within a few hours in some people. While the effect varies from person to person, the science behind nitric oxide is well established. But before you start drinking gallons of beet juice, let's talk about what these studies really mean. Most participants experienced modest improvements, not dramatic overnight cures. If your blood pressure is dangerously high, beets are not a replacement for prescribed medications or medical care. Instead, think of them as one powerful tool in a much bigger toolbox. So how can you add beets to your diet? You can roast fresh beets, add them to salads, blend them into smoothies, or drink unsweetened beetroot juice. Just remember to choose products without added sugar whenever possible. Now here's another interesting fact. Some people notice their urine or stools turning pink or reddish after eating beets. This harmless condition called beeturia can look alarming, but it's usually nothing to worry about. There's another reason beets deserve attention. They're also a good source of potassium, an important mineral that helps balance sodium levels in the body. Since many Americans consume too much sodium and too little potassium, increasing potassium-rich foods may further support healthy blood pressure. But here's where many people get confused. They focus on adding one healthy food while continuing habits that raise blood pressure every single day. Eating beets won't fully offset a diet loaded with processed foods, excessive salt, sugary drinks, smoking, poor sleep, or a lack of physical activity. Blood pressure reflects your overall lifestyle, not just one meal. If you truly want healthier numbers, combine foods like beets with other heart-friendly choices. Leafy green vegetables provide additional nitrates. Berries contain antioxidants that support blood vessel health. Oats provide soluble fiber, which supports heart health. Fatty fish like salmon supply omega-3 fatty acids. Nuts and seeds provide healthy fats and minerals. Together, these foods create a dietary pattern that's far more powerful than relying on any single superfood. Let's also discuss one important warning. If you have kidney disease or certain medical conditions requiring potassium restrictions, always talk with your healthcare provider before making major dietary changes. Likewise, if you're taking a blood pressure medication, don't stop it simply because you've started eating healthier. Many people feel better after improving their diet and assume they no longer need a medication. That decision should always be made together with your healthcare provider after monitoring your blood pressure over time. So how can you maximize the benefits? Try pairing healthy eating with a brisk 30-minute walk, limiting processed foods, maintaining a healthy weight, reducing excess alcohol, managing stress, and getting 7 to 8 hours of quality sleep each night. These habits work together to support healthy blood pressure much more effectively than any single food ever could. Now let's answer the question we started with. Can one food really drop blood pressure overnight? For some individuals, nitrate-rich beets may produce a small, measurable reduction within hours, thanks to improved nitric oxide production and healthier blood vessel function. But lasting blood pressure control comes from consistent healthy habits, not overnight miracles. The good news is that every healthy choice you make gives your heart and blood vessels another reason to thank you. So the next time you're at the grocery store, don't overlook the bright red beets sitting quietly in the produce section. Sometimes the simplest foods carry some of the most impressive science. If you found this information helpful, subscribe to Dr. Jhon A. Demaria for evidence-based health education that helps you separate medical facts from internet myths and empowers you to make smarter choices for a healthier heart.